Okay, fine. So today I'm going to discuss something that is a little bit different than what we used to discuss in our classes. So it is an introduction to artificial intelligence in eye care industry, or in particular in ophthalmology. So nowadays, no one can leave behind or cannot ignore technology and the level at which it has reached. So the new thing that is we are listening every day or some day or another day, the news coming is about artificial intelligence. So what mainly I'm going to discuss in today class. So before discussing all those things, so just a little disclosure from my side. So this is not my field. I just try to watch some videos and try to read articles on this, and on the basis of that, I am presenting this. So maybe there would be something that I would not be explaining very well, or might be not like. Uh, I cannot say from very confident like I know these things. So I just wanted to share the things which I came to know while I was researching on this topic. So I will basically discussing about artificial intelligence from the introduction of artificial intelligence from the non-technical perspective, not going into the technology like what is AI. So when we are talking AI, so three terms basically come like machine learning, deep learning with artificial intelligence. So also I would be giving a very brief introduction about what machine learning and what deep learning is. Then artificial intelligence in eye care. So till now, how artificial intelligence has been used in eye care, and what could be the possible future direction where it is heading, and at last what are the ethical issues with AI, artificial intelligence, that also a very brief. So first, in introduction to artificial intelligence and machine learning. So artificial intelligence is something we can say that it is the ability of a machine to think like humans, which till now kind of science fiction. Still it is not possible for machines to think like us, like humans. But this is something that all the artificial intelligence or all the new technology that is coming on AI is aiming. So they want to make machines, or they want to develop machines on that level where they can think like humans, or maybe better than humans, or superhuman level. So there are two sub part of artificial intelligence that known as machine learning and deep learning. So machine learning and deep learning is the subset of artificial intelligence. So what is basically the machine learning? So machine learning is something which we can say it is a like best approximation of what AI would look like when it would fully developed with all its feature. So machine learning, I will be discussing in my next couple of slides, like what machine learning is. But basically, machine learning is a subfield of AI, which giving machines the skills to learn from examples without being explicitly programmed. So what that mean, I will also discuss this thing. And then further subset of machine learning is deep learning. So deep learning is like a specialized machine learning technique enabling machines to train themselves to perform tasks. So if you read all those points, it all saying that this new technology, it is like till now what is happening, we are giving some programmings, we are doing some coding, programmings, engineers in the computer. So they are programs coding, and according to that, application run. But what artificial intelligence is aiming that the machine can make their own decision like human do. We don't need a code to perform a task. So that is what it's aiming. So what is a machine learning? So machine learning is a tool set to solve hard problems. So like here, the name itself is explanatory. So it is like forcing machine to learn something. How to learn? By giving examples, by giving pictures to the machine, by giving them data. So machine learning can be comprises of these broad areas like language, robotics related to machine, and that is machine mechanics, that is robotics, then speech recognition, and then computer vision. So let's discuss one part, this computer vision part. So computer vision is not that computer vision that we discuss in our diseases. That is not computer vision. Here, the computer vision means that to give machines ability to see like we see or like animals see. So can we give machine that ability that machines also can see like we can see? Like when we see two animals, like one there is a dog and then there is a cat. So as a human we can identify which one is a dog and which one is a cat. So can we give the same ability to machine by machine learning process, so that they can identify between different objects, or they can see, or their vision could be like uh, humans, or could be like animals the way do. So it is like it is written, it is not something that's very simple, it is a very complex process. So let's talk about a computer vision. So when we wanted to give a computer a vision like what we as a human see or animals see, so there are things that need to be worked, or we need to make a machine aware about the physics related to vision, maybe about light, like how light refract, how light goes through a lens, how light behave in a different refractive index media. And then there also machine need to be trained on neuroscience, like once light reach to our brain or our retina, then how it process from retina to brain. And then so after putting all this data, like data on physics related data on vision and physics and neuroscience, more a kind of biology related data on vision. So if you can incorporate these data through machine learning, so maybe possibly machine also can have uh, possibility of seeing things like what human, like how we see or an animal see. And so machine learning is one technique through which we can achieve this. And there are other techniques also like deep learning, which is a kind of subset of machine learning, then decision tree kernel methods. So we would be restricting only towards machine learning and deep learning. So let's talk about like how machine learning is different. So still we are talking about machine learning. So machine learning, as I shown my previous slide. So machine learning is a subset of artificial intelligence. So still we are at a level of machine learning, though companies say that artificial intelligence they have in their software, but this is what actually is. So let's see how a machine learn. So this is how we are doing till now. Maybe most of you are aware of computer programming. So there is a programming code. So there, for example, there is a programming code for cats and dogs, which is shown by a box here. So you or an engineer, software engineer, has written a program code for just 1 minute. So like what till now it is happening for a cat, the programmer will write a code like what should be the coding for a cat, and once that application will uh, show once that application will have a cat picture, it will match with a program and it will say it is a cat. Similarly, it can do with a dog. There is would be a programming for dog, and when the machine and when the computer application will get a dog picture, so after going through the coding, it will say it is a dog picture. So this is what happening till now. This traditional computer programming. So what happened? Programmer sit and if they have to make a coding for coding to differentiate between cats and dogs, so they will try to think all the possible differences between cats and dog, and according to that, they will write a code. Coding is nothing but coding is like instructions given to a computer. Things, what things you have to do, what things you don't have to do. So that is what how the computer understand things. So this is what is happening till now. So a programmer write a coding for how to differentiate between cats and dogs on the coding on the parameters of all the differences that coder has put it in the program, and at the end we have a program to differentiate between a cat and dog. Now what is different in machine learning? So in machine learning there is no coding, so you're not seeing any coding there. So what it does, there would be multiple cat pictures with a different color, maybe different shape, and there would be multiple dog pictures, maybe with different color, different shape, different size, different breed, and all these pictures would be labeled. So the computer would get a label picture. So if God is at this texture, this size, so what kind of dog is this? Then what breed of dog is this? So all the pictures are labeled, and that pictures goes into the machine learning algorithm. So here the machine get training. How it's get training? It's get training by labeling. All the pictures has been labeled with some information, and through going through an algorithm that has been designed to differentiate between cat and dog, the machine whenever a picture come, the machine take that picture through its algorithm, and at the end it tells that what that picture is, whether this picture is for cat and dog. So the basic difference here that we are seeing that here the our traditional method where there is no machine learning, there is no artificial intelligence, there is a programmer which is basically saying machine to what to do. Here no learning for machine. Here the machine is learning. How it's learning? So the more data the machine gets, the more it learns. If it is getting 100 different picture of a dog and 100 different picture of a cat, from each picture there would be some labeling, and from each picture machine is getting some data that in terms it is putting its algorithm and something new it's learning. And more the data it gets, more accurate the machine would be in deciding or telling that what picture actually we have shown to the machine. So this is just a brief idea about what machine learning. So just give a brief journey, detour about the computer vision. So this is computer vision, the thing that I have just told, like how can we can develop this ability for computer to see. This is one like way to develop an ability for computer to see. So just to give an like journey that how it has been started and where it has reached till now. So some basic like terminology that we need to know is like data sets and benchmark. So data sets are actually large collections of data, and they are used to evaluate the performance of a new machine learning methods. And popular data sets are called benchmarks. So for example, if you have a data set, very large collection of data, for example, dog picture. So the larger your data means that would be your data set, and those that data set which is having larger collection of data, that would be called as a benchmark. So there would be multiple data sets for a dog picture, but that set would be called as a benchmark which would be having largest number of data. So in this case we are taking an example of dog. So there is a annual event known as a ImageNet Large Scale Visual Recognition Challenge. So there what happened, different company comes and they present their data set, and whichever company or programmer on those having the largest benchmark, means having the largest data sets, and their data set can accurately identify pictures. So just to give an example, like here it is written. So challenges invite group to beat previous records and popular benchmarks. The ImageNet Large Scale Visual Recognition Challenge consists in classify 1.2 million images into one of 1,000 categories. Now, just to give an example, suppose you have a challenge. So here there is a data set where 100 picture of red fox, 100 picture of hen, 100 picture of ibex, 100 picture of goldfinch, then so on, 100 picture of tiger, and then hamster. So it is like that you have a data set. So the challenge is that the computer has to identify the correct picture which we wanted to from computer to identify. So suppose if we have given computer this uh, like how much it is, like 1 lakh picture. So this is total, and in that picture we wanted computer to tell us accurately hamster picture. And if the computer among these data set is able to correctly give us a one picture of hamster among all these pictures, so we say that that benchmark is good, means that algorithm or that learning is quite accurate. So so this challenge that we are talking about, this challenge used to be thought as the ultimate test, because it was thought as it is impossible for a computer to correctly identify one picture out of these 1 lakh pictures. So that was thought that it is impossible or it is very difficult to do. That's why it is the ultimate test. And with best algorithms classifying image correctly, there are chances of 74% only chance that computer or algorithm is able to correctly identify the picture that we wanted to know. That is way behind the human performance. So human, if we present to human this number of data sets, so the human can identify the correct picture with 95% accuracy that we wanted them to identify. So that was the story till 2011. In 2010, the machine learning ability was only, so they are doing things with 28% error. In 2011, they are doing with a 26% error. That is way behind from human accuracy. So till 2011, it is not a big deal. But 2012 has changed the things in artificial intelligence. So in 2012, what happened, a Canada-based company, they have adopted an old-fashioned technology that is called artificial neural networks to shatter the image net record. And this event heralded a new era in machine learning, which is nowadays we all the AI or machine learning that we will be reading about, they all would be talking about this technology, CNN technology. So like when you are like some of the mobile companies, they say that their hardware is having artificial intelligence capability, and they will say that their artificial intelligence work in the CNN network. So CNN is basically convolutional neural network. So in the next slide, I will try to explain a little bit what this thing is, and deep learning. So after introducing this CNN network, so the accuracy level of machine learning has been dramatically changed. So if you see this bar graph, So this dotted line is actually the human accuracy or human error level that we can say about 5%. So 95%, there is always human can identify things 95% with 95% accuracy. Only there are 5% chance of error. But after 2014 and 2015 and 16, the computer machine learning even beat the human error level, and their machine learning has developed so much so that they can have a error only 2.25% or 3%, and it's improving year by year. So might be in future we can see a machine with superhuman accuracy, with 100% accuracy that is impossible with humans. So this is about deep learning. What actually this deep learning? Till now we are discussing about machine learning. So deep learning is a subset of machine learning. Means it is a deep learning on which machine learning work. So what actually this deep learning is? So here, this deep learning actually work on CNN network, that is convolutional networks. So here to give an example, like see, we are talking about, so suppose you wanted to develop an algorithm which can correctly identify this dog, not only this dog, but also the breed of dog, which breed this dog is. So the machine, what will say? So the machine is going to analyze this picture through its algorithm in different layers. So here in the first layer, what the machine does or machine learning does in deep learning, that it only try to identify the colors, that is basically red, green and blue, which will say machine that which color this dog is, eyes color or maybe body color. So that's how our vision also work on red, green and blue cones. On the second level, the machine will identify the shape, the outer shape, like structure. What shape is this? At the third layers, it will analyze further and it will go to the textures. So textures means like shape of different parts. So how the ears are, what is the shape of legs. Until the machine reaches to the fourth layer, the machine is very well able to differentiate a dog picture from other animal picture. And and it will not stop here, it will go further and it will analyze with furthermore, and there it can tell on also can tell about the what breed this dog is. So we have shown this picture, and by machine learning by deep learning, the computer can able to take with 83% accuracy that this dog is maybe husky breed. So we are talking only about this five layer CNN network. The present CNN networks can goes up to 150 or 200 or more than 200 layers. So you can think about the accuracy of like telling anything correctly, depending upon what algorithm this machine learning has been designed for. So one thing you all would be noticing that going to these deeper levels need data. So here you need a very few data. As you go deeper into the different layers in CNN, so you're needing more data. So that's why we are seeing these all big giant tech companies like Facebook or Google or similar companies. They never charge for their services. You will not see Facebook is charging you anything for using their services, or Google is charging you anything for using their Gmail or their Google Forms or whatever the services they are giving. So what actually they are getting from that, offering those things free of cost to us? So they are getting data, a lot of data from us. And more the data they will get, the more accurate their machine learning would be. And more the accurate their machine learning would be, more accurate they would be predicting or telling things. So now from here, just to give some examples, like after 2015, when the machine learning accuracy even surpassed the human error level, so how this machine learning made the big headlines in news, or we nowadays will are talking a lot or seeing a lot about the algorithms. So like in 2016, it was a big headlines on all the newspapers or TV channels. So Google AI that they have developed for this game AlphaGo, which is especially for a chess game. So there, what in this game happened, the machine AI, this AlphaGo machine AI has in a competition, chess competition, seated in a chess competition with a grand slam, with a like chess, world renowned chess, what we say, winner. And in that, the machine AI beat the like world number one chess player. So that was a big news. So that was 1-1. In 2019, it was even bigger. So 2015, there was a game known as a Dota 2. So in Dota 2, what happened? The computer AI is not beating. Here in 2016, it's only beating 1%. Here in 2018, they beat 5%. B class. So here in 2019, the computer AI not only playing with the 5 humans, they also beat the 5 humans. And here, 5 computer AI playing with 5 human beings. So the complexity is that they are not only playing games, but the AI are also interacting among themselves. So those 5 AI interacting among themselves like human do when you play a game, and they have beat the humans. So that was a big deal, and that make a big news. And in 2020, actually, the AI moved from the gaming to the like medical sciences. And the news was that DeepMind AI is actually a Google branch. So Google AI subsidiary known as a DeepMind. So Google have developed a DeepMind AI for the identification of protein, and that AI is able to identify the protein of the drugs. So that was a big deal, and that leads very like future possibilities of developing new drugs, because the machine can successfully identify the proteins which are very small in structure. So that was all like a brief introduction about machine learning, deep learning, and what is the big deal with this machine learning. Now, how it is how machine learning is used in our eye care. So among all the medical field, different branches of medical field, the highest number of AI use is in the ophthalmology or eye care services. So the reason being is that, so if you see all the eye care, like investigation or the examination steps, everything involved capturing images. So we capture a lot of fundus images. We capture retina images. We capture cornea images. We do corneal topography. So while the AI is focusing more on ophthalmology, because there are a lot of data in digital medium, which might not be available with other medical specialty. So artificial intelligence in ophthalmology tends to focus on imaging and the automated interpretation of fundus photographs and optical coherence topographies. So the present status of AI in ophthalmology, that they are trying to develop an artificial intelligence algorithm which can, so if you show a fundus photo, if you pass a fundus photo through that algorithm, through that AI, artificial intelligence algorithm, so that algorithm is, by the process of machine learning, able to identify that this kind of fundus picture is possibility is having what diagnosis with how much accuracy. Same with the OCT. So apart from this patient disease management, there are other areas of interest like patient management, disease risk prediction, progression analysis, and automated interpretation of non-imaging modalities like visual field test. So why eye care is a good area for machine learning? Because as I already said, we are capturing a lot of data, and like data that is we do from OCT or fundus photo. So nowadays machine are giving 2D and 3D photos, so which is even better for AI or machine learning. Second reason being that people who are in medical ophthalmology, they are tend to be more aware with technology than other branches, because even when there are no AI or these advanced technology thing, still, so OCT is very old thing in ophthalmology. So if you are OCT or fundus photo, if you are handling those things, you need to be aware of little bit of technology. So that is not the case with the other medical branches if you go. And normally this photo caption facilities in eye care available with small hospitals also. Like nowadays we have photo capturing capability at our vision centers also. So that is the reason that in eye care AI is like we have seen more advancement of AI in eye care field than other medical fields. And other than disease process, the AI can also be used for uh, patient better management. Like we do triaging. So a patient is coming into the hospital. So how will that we decide that this patient is urgent, this patient is semi-urgent, and this patient is non-urgent? So what we do till now that a clinician go see patient, talk with the patient, gather their data, and then they decide that how urgent this patient is. But if that work can be done through an AI, so a patient come, write their complaint, and we have a picture of their eyes or fundus, the machine can tell that how urgent or non-urgent or semi-urgent this patient is. So this is another possible use of AI in the eye care. So there are three landmark moments where AI has very successful in ophthalmology. So the one is in 2016, a study that was published in Data and Benchmark. So that is a very like premier journal, respected journal in the field of AI. So in 2016, they published this diabetic retinopathy detection. So where they have shown that AI or machine learning can be used to screen diabetic retinopathy or diabetic patients in the community or without the help of a doctor. And in 2016, also DeepMind, that is, like I said, it is a like subsidiary of Google, which basically work on artificial intelligence. So DeepMind is Google has a collaboration of Moorfields Eye Hospital. That is one of the premier eye hospital in the world. That is in UK. And so here till 2016 or before 2016, AI is only academic topic or lab topic. So people are doing writing academic papers or giving theories. But once the big giants like Google and these companies involved in these things, means it is no more only an academic topic. Now it has become a commercial topic also, because this company is going to develop some algorithm and out of which they are going to earn money. And in 2018, the great landmark moment was that when FDA has given approval for diabetic screening to an artificial intelligence model. So they have given approval that apart from doctors or human, an artificial intelligence algorithm also can be used, and that is acceptable for diabetes related eye problem. So till now, whatever the like data that is available, that shows that in eye care, uh, the AI is mostly used for diabetic retinopathy. Then glaucoma is the second area of interest where there is a higher number of AI use. Both these two field favors diabetic glaucoma and ARMD. They favor AI because all these are all the because in these cases information can be getting from fundus picture or disk picture. So that's why these are the top like interesting or top focus area for AI in eye care. These are the other area which is currently now in progress, but till now not very anything much substantive on these things, but these are well established, especially the diabetic retinopathy. So, but one issue that Google has come up with in their article or in a like interview. So they come up with an algorithm, and when they did algorithm testing that was done in Thailand, so they found that algorithm or this AI algorithm, they do super accurate, super human accuracy in the labs, but when they come into the clinics, there the story is different. Because the lab is a very standard situation. Everything is in control where this software algorithm has been tested. But when they go actually in the clinical scenario, so they are not working as accurate that they are supposed to be done. So still, this AI in the eye has a long way to go, and still there are a lot of like in my previous this like slide. So in 2016, it's already there is an article which has been shown that diabetic can be used successfully by using AI, and it's now 2021, and it's still there are researches going on, and companies like Microsoft, Google, and other tech companies are actively working in developing their algorithm. Because what happens if your algorithm is not correct in the clinical setup, so the acceptability is not going to be there. So what is the future? Not future, but actually it's happening. So AI is now has moved from diagnosis to predicting also. So till now, what we have discussed that their AI is only predicting, or only like diagnosing things on the basis of picture. So I have given an example of dog picture. So how AI or machine learning we use, or how machine learning or deep learning, machine learning use deep learning process to correctly identify a dog breed. Similarly, machine learning can use deep learning process with the help of data sets that would be having with that by seeing a fundus photo, correctly identify that this fundus photo is a with is it would be representing in ARMD or diabetic retinopathy with 83 or 90% accuracy. The machine can tell. But now, apart from diagnosis, AI is also predicting. Like this again, this article that is published in Nature, and that also has been a lot talked about article where they have shown that fundus photo can also predict, apart from diagnosing the condition of the eye, they also can predict the cardiovascular issues from fundus photo. And it was a great article of interest. And then there was another article that published in Nature Medicine where they have shown that artificial intelligence can also predict from a fundus photo if there is a drusen or very early drusen or exudates, like when it, after how many time or how much time it will convert into a wet age related macular degeneration using deep learning. So that is a great like kind of achievement. Human cannot do that. They cannot predict this thing, but the machine using by using the process of deep learning they can predict those things. So to end this thing, whatever I have understood in machine learning or artificial intelligence in ophthalmology or eye care. So there are four ways artificial intelligence could impact eye care. First is the decision support. So one thing is very sure that it is not going to replace human. So artificial intelligence only can help us or a clinician to reach a better diagnosis or error-free diagnosis. The treatment part is still with the clinician. They have to treat. Machine can't treat. Then AI would be very successful in biomarkers discovery. So biomarkers are, anyone understand what is biomarker? No? Can anyone tell me what is biomarker? One.
So is it like normative data? So normative data of any machine?
Yes, something like that. So just give an example, like, so suppose take an example of keratoconus. So biomarker you can understand is a kind of sign, biological sign. So when we do slit lamp examination and when see Fleischer ring, so Fleischer ring we say that this eye cornea is having a Fleischer ring, so that this cornea could have this thing keratoconus because it is a sign of uh, keratoconus Fleischer ring. So here the Fleischer ring is a biomarker. So similarly, so like we know that in ARMD, that drusen's are the biomarkers. So if they are drusen, you can say, or in CSCR. So there is an NSD, so that is a biomarker. NSD, and that is one of the sign of CSR. So can we have those biomarkers? That is still not known. So AI can predict those small biomarkers which is not pickable by human eyes. So like in the previous articles that has been published in Nature journal where the AI is able to predict cardiovascular disease from a fundus photo. So how they are able to disease, how able to that predict? So they must have identified some biomarker, some sign, and that sign is a specific, that fundus sign is a specific with people having cardiovascular disease. So that would be one of the great discovery, because if we identify biomarkers in a very early stage, so we can save a lot of patients from going blind, especially those suffering from the retinal diseases where the early detection and early treatment is the key. It is can be used successfully in screening and trials that already has been started. So you don't need, the future is going to be that people don't need like competent people, like subject specific competent people to go and screen the people. That part machine will do. The only thing that they might be needed as someone to operate machine. So anyone can go and operate machine, they screen, and the machine will tell you that whether this patient is having operatable cataract or not, whether this patient is having significant diabetic retinopathy or not. So something like that. And this last one is one thing that is still the exploration is going on, that can AI can be used for training and mentoring. So they are looking for the way where the like the AI can also work as a trainer. So there's no need of humans for training or mentoring. So so they say that whatever we are seeing now in AI, it is only the tip of iceberg. So we are only seeing the very small part of AI, and the potential and the possibilities are unimaginable. We cannot imagine right now that after 20, 30 years, what it will lead to. But like every like technological issues, there are ethical problems, and some of the ethical problems that also has been reported. So one of the ethical problems with the AI is the prejudices and biases. So like one of the algorithm, AI algorithm that is used for Amazon to hire employee. So though that algorithm is prejudiced or biased to hire only male employee, and that's why they have ditched or they have removed that AI from their system. So that was one biasness. That biasness can be because of the data, because AI work on the data. In the USA, they found AI that they be using in hospitals. So that AI was highly biased for races. So they are biased towards Black patients. Means that report that AI is giving is kind of biased. Means every disease they are attributing to the Black people, whether even if they are healthy, they are attributing to the Black people. So these are the kind of bias, data bias, algorithm bias, and these are the things that machines are working on. But that is a great risk with the AI, and it is the great area. Means currently the hot debate area. So whether we should go for full scale AI or it should not be, because with AI, there are a lot of ethical issues that come, like biases we have seen, and exploitation also that can be happen, not in patient, but with the employee or other things, those other things. So to end, there is a very small video about like current use of AI, that is this algorithm basically developed by DeepMind, how they are working in ophthalmology.
Dear fellow scholars, this is 2-Minute Papers with Károly Zsolnai Fehér. In this video series, we often see how these amazing new machine learning algorithms can make our lives easier, and fortunately, some of them are also useful for serious medical applications. Specifically, medical imaging. Medical imaging is commonly used in most healthcare systems where an image of a chosen set of organs and tissues is made for a doctor to look at and decide whether medical intervention is required. The main issue is that the amount of diagnostic images out there in the wild increases at a staggering pace, and it makes it more and more infeasible for doctors to look at. But wait a minute, as more and more images are created, this also means that we have more training data for machine learning algorithms, so at the same time as doctors get more and more swamped, the AI should get better and better over time. These methods can process orders of magnitude more of these images than humans, and after that, the final decision is put back into the hands of the doctor, who can now focus more on the edge cases and prioritize which patients should be seen immediately. This work from scientists at DeepMind was trained on about 14,000 optical coherence tomography scans. This is the OCT label that you see on the left. These images are cross-sections of the human retina. We first start out with this OCT scan, then a manual segmentation step follows where a doctor marks up this image to show where the most relevant parts, like the retinal fluids or the elevations of retinal pigments are. Before we proceed, let's stop here for a moment and look at some images of how the network can learn from the doctors and reproduce these segmentations by itself. Look at that! It's almost pixel perfect. This looks like science fiction. Now that we have the segmentation map, it is time to perform classification. This means that we look at this map and assign a probability to each possible condition that may be present. Finally, based on these, a final verdict is made whether the patient needs to be urgently seen or just a routine check, or perhaps no check is required. The algorithm also learns this classification step and creates these verdicts itself. And of course, the question naturally arises: how accurate is this? Well, let's look at the confusion matrices. The confusion matrix shows us how many of the urgent cases were correctly classified as urgent and how often it was misclassified as something else and what that something else was. The same analysis is performed to all other classes. Here's how the retina specialist doctors did, and here is how the AI did. I'll leave it here for a few seconds for you to inspect it. Really good. Here's also a different way of aggregating this data. The algorithm did significantly better than all of the optometrists and matched the performance of the #1 retina specialist. I wouldn't believe any of these results if I didn't see these reports with my own eyes in the paper. An additional advantage of this technique is that it works on different kinds of imaging devices, and it is among the first methods that works with 3D data. Another plus that I really liked is that this was developed as a close collaboration with a top-tier eye hospital in London to make sure that the results are as practical as possible. The paper contains a ton of more information, so make sure to have a look. This was a Herculean effort from the side of DeepMind, and the results are truly staggering. What a time to be alive. Thanks for watching and for your generous support, and I'll see you next time. Dear fellow scholars, this is 2 minutes. Dear
Okay, so that was the end. So my my summation would be like, we are living in an era that we cannot lag behind. So, and being an optometrist, like, we are the second person. So doctors are there, so they would be busy in like treating patients. So here comes the role of optometrists. I know many optometrists. I know at least like 3 optometrists who are working with these companies, these technology companies, Microsoft and some other these IT companies, where they are working on developing these algorithms at AI base to diagnosis of a disease on the basis of fundus picture. So being an optometrist, we need to be aware about these happenings that is going in our field. And these are the things that is not very difficult to understand. You just go and watch some videos, read something, and you will understand. So at least make yourself aware of these things also. You cannot be like in the era of 5 years back, because in last 5 years, this thing AI has changed significantly. So make yourself more aware of, try to create an interest in these areas, so that who knows, if you get an opportunity, you can work this with these companies also as in a like coder, because all those pictures need labeling, and there they need optometrist, ophthalmologist. Okay, so why not develop our skills, especially those who are in the retina? They try to be good in retina examination, fundus examination, that skill might help them maybe in future. So to end this, what do you think? Like, you people just can raise your hands. Like, how many of you think, like, what are your views about AI or feelings regarding AI in eye care? So how many are excited? How many are fearful of this AI? Or how many feel that there's no difference? And there would be some people who would be confused, like, what is actually this, and nothing in particular. So maybe first we excitement. How many of you are excited maybe to see more AI, what it's doing with eye care? So only 2 people. So let's see how many of you are fearful. You can just raise your hands. Only Piyush is fearful. Piyush, Aman, okay, 2 people. How many feels that and that would not going to cause any difference? The things would be same. So anyone who think that is not going to cause any difference, the things would be going to be as it is going on. So that is something that is not going to happen. How many you are confused? None of. Okay, again, nothing in particular. Okay, so any questions? But
Hello, sir.
yes, Helen.
Sir, so if there is advancement in AI, that would mean that like the need for like employees, we can say the need for people would be lesser, right, sir? So does that mean that like the future of like any field, because everything is going towards technology only, so the need for like the human work, this like the hard work, we can say, this will reduce or not?
The way I say, definitely it will reduce. Means those works which need a lot of mechanical work, so those areas are going to be impacted, I think. Uh, nowadays there are machines which in one like go they can do everything. So it's still not very like in popular, but they can do your refraction, subjective, objective, subjective refraction, also best possible subjective refraction they will tell you according to the patient age. And then at one click they will give you the corneal topography, fundus picture, everything. So in next 10 years, I don't know, like this retinoscopy would be how much feasible in the adult patient. Definitely it would be there in the pediatric patient. So the message is that we need to like keep how we say adapting with a new situation. So the bottom line is that those area which is more human intervention, mechanical intervention, that is going to be impacted. Not all levels. Hope you got the answer.
Yes, sir. Thank you.
Any more questions?
So, it's Agniv. So, is there any when it's work AI works? So it's all works in previously loaded data, or it may create new data, or it may create some no, it may create some knowledge with other datas. Like suppose with this picture I tell, if machine don't know how dog look like, so machine can tell it is dog or not.
No, machine cannot tell. Machine does not know what is dog, what is cat. Machine does not seen dog.
So because I am thinking, because sir, I saw some mobile application in nowadays. They told if I show some picture with my camera, this Google tells what is this picture.
Correct. So that is coding. So in the like software, there is a coding. In the hardware, there is a coding. There is a coding for different pictures. So that is coding. That is not machine learning. So already there is a coding. So sometimes they will tell you some picture. They will not tell you everything. So that programming is already there. So that is true. That is coding that we see. But that is machine learning. So machine learning by definition, it needs a lot of data, and all data should be labeled. So like what happening in the eye. So, might it be there in LV Baswal also. So like Microsoft has collaborated with 3 or 4 big hospitals, Shankar Netralaya, AIMS, maybe LV Baswal also, I don't know exactly. And they have a fundus camera machine that they have shared, or they have kept with small clinics, and or also with the optometrists. I know a few of my optometrists who are friends who are doing private practice. So Microsoft people have approached them, not Microsoft, like companies like JICE, those using Microsoft software, and they would be saying that we install a fundus camera at your clinic free of cost. What you have to do, you have to click a picture, and that picture you have to send. So when you click that picture, so that picture automatically will go to their server, Microsoft server, and the Microsoft server send that picture to the 4 hospitals, retina specialist. So one in there it is in LP Prasad, one there it is a Shankar Netralaya, one in AIMS, and one somewhere else. And all those 4 consultant will label that picture. So they will tell that what is sign that they are seeing. So that everything would be done in a software. So in the software, they will say that this particular area is having drusen, this is having neovascularization. And the labeling is coming from 4 different consultants, retina consultants. So likewise, they gather. So this thing is going since last 3-4 years. So just imagine till now how many data they have gathered. And India is their focus country. Why? Because India, we have a lot of population, so we can get maximum number of data from here. So they are providing everything free of cost. Why they are providing free of cost? Because they are getting data. So more the labeling they will get, more there would be a labeling picture in the machine learning, and that's how the machine will learn more. And at the end, the machine will be able to diagnose a condition just only seeing a picture, fundus picture that goes through that algorithm. So algorithm is the key. That YouTube algorithm is has that algorithm that is the most costly algorithm in the world, and it is one of the patent algorithm. So you watch any video in YouTube, so next time YouTube will suggest you, automatically will give you that video on the basis of the video that you have watched, similar kind of video. So that is algorithm, that is machine learning, that algorithm is doing.
Sir, if we want to take partner in all this AI advancement, how do we integrate ourselves into it?
Yeah, so one of the very good questions. So one of the way we can do that, a little bit awareness of technology. I'm not saying to just go and do coding and those things. If you can do it, is a great thing. Or more awareness about what is this machine learning and deep learning process. There are different kind of this area. And so one thing you can make yourself skilled with so one area is the fundus photo, the second area diabetes, and the second area is the glaucoma. So you can be having some what I say certificate, training certificate in like fundus photo examination, or accurately, or some training in glaucoma fundus evaluation. So nowadays companies are looking for those people who can label their pictures, because doctors are labeling, but they also need someone with them. They can't hire doctor for two reasons. Doctor are very costly, and the second is that mostly doctor would not be ready to work with them. So they are hiring optometrists. So if you can make yourself aware of those skills, so little bit technology and more like these hardcore skills, better evaluation of fundus photos, so that can help you in working. So that need to be with some certificate. You cannot just go and tell them I am very good in fundus evaluation. They need some kind of certification. So one such kind of certification earlier, it was providing by the LBPI. It was a 6-month fellowship in retina, diabetic retinopathy, something like that. I don't know now they're doing that or not. Aginip can tell this.
There are no diabetic retinal fellowship, but there is one course like early diabetic detection, that's managed from Melbourne or Sydney University. We need to go in their website. That is totally free, and we can do some course. We have to read, and we have to label this diabetic retinopathy for a fundus photo in different findings. So
Yes.
that is quite difficult. I have tried it 10 to 15, still I am stuck in second stage. But
that's why it's difficult. But once you will be getting that certificate, and those companies will hire you, will getting a like salary in lakhs.
So I think you know that Alamgir got
Yeah,
this
I know.
like that
Yeah.
only.
So apart from salary, means like these are the skills that will help you. So you can. So like I said, it is not only a skill. You need to be certified also.
Okay, thank you, sir.
Okay. I think we have done for the day. Okay, so thank you everyone. I'm going to end this class.